नमस्ते बच्चों, खुश रहिए आप लोग। I myself Jivian Pratishtha Ranveshi, working as an assistant professor in optometry discipline in the Department of Faculty of Physiology and Diagnostic. I am working in Vidyapeeth Women's University, which is the first state women's university in Rajasthan. Now, today I will be discussing about the vitreous physiology. Before that, I would like to tell that what is vitreous. You have studied in your previous class about the vitreous. What is vitreous? But for quick revision, I will be summarizing you. So, what is vitreous? Vitreous is a inert, transparent, colorless, jelly-like structure present in the posterior cavity of the eye. Okay, largest and simplest connective tissue present as a single piece in human body. Bounded anteriorly by the lens and ciliary body, posteriorly by the retina. And its weight is 4 grams and volume is 4 cc. Its shape is as the shape of the vitreous cavity. Now, what is this is what I want to say that you have studied about the haploid layer membrane, anterior haploid layer, and posterior haploid membrane, cortical vitreous, medullary vitreous. Medullary vitreous forms the majority of vitreous body, and the vitreous tracts also, and attachments of vitreous. What are the attachments of vitreous? Just like the ora serrata, posterior lens capsule, margin to optic curve, macula, and retinal vessels, most variable and weakest. Okay, now vitreous base. What is vitreous base? You have this also you have read in your previous class. Refers to a 4 mm wide zone of vitreous, approx 1.5 mm anterior to ora serrata nasally. It extends 3.0 mm posterior to the ora serrata and 1.8 mm temporally. Extend from posterior on the posterior side, but is actually wider nasally. Attached formally to ora serrata. With age, it widens anteriorly and posteriorly. Okay, now you should know about you know about the retrolentar ligaments. Okay, means the haploideo-capsular ligaments is another strong addition of vitreous and posterior capsule of lens. Now, at macula, vitreous is attached with the macula in an annular fashion with the diameter of 3 to 4 mm. It is also attached along with the larger retinal vessels. Haploid arteries are S-shaped arteries. Haploid canals extends from optic disc to the post pole of lens. In fetus, haploid artery runs inside it. Walls formed of vitreous condensation. Haploid artery disappears 6 weeks before birth. Starts from patellar fossa as a widening and again widens near optic nerve had to form space of Martigny. Now, you should know about the physiology of vitreous. This one is important. Physiology of vitreous is also somewhat discussed in the previous lecture also. There are 3 major components: water, collagen like fibers, and hyaluronic acid. Now the collagens, hyaluronic acids, and soluble proteins. About 10% of the serum concentration and thus does not scattered. Okay. Now the physiochemical properties. Optical properties. First one is the transparency, fine arrangement of vitreous fibers and high water content. Tyndall effect, presence of low amount of soluble proteins accounts for absence of light scattering, light transmission. Transmits 90% of light between 300 to 1400 nanometer. Plasticity, viscoelasticity, gel stability, these all are discussed in the last topic. Molecular sieve effect selectively inhibit the movement of water, large molecules and cells. Vitreous expansion and contraction. Vitreous has sodium ions and protein molecules which neutralizes hyaluronic acids. Functions of vitreous body: supporting the function and filling up function, diffusion barrier, metabolic buffer function, establishment of an unhindered path of light. Then the support function of the retina and filling up function of the vitreous body cavity. An intact vitreous fills up the entire vitreous cavity, thus retarded or prevent development of the larger retinal detachment. The vitreous body can also absorb external fiber forces and reduce mechanical deformation. Now, what is the diffusion barrier between the anterior and the posterior segment of the eyes? The vitreous body a gel has a considerable barrier function for bulk movements of substances between anterior and posterior part of the eye. Substances that are liberated from anterior segment of the eye will have difficulty in reaching the high concentration in posterior part of the eye. An intact vitreous gel also prevents topically administered substances reaches the retina. Entrance of antibiotic from the bloodstream to the vitreous. Pathological or pathophysiological correlations. If the vitreous body removed, degenerated, collapsed, exchange between anterior and posterior part faster and easier. Lens removal and anterior vitrectomy. Substances that are produced in the anterior segment of the eye and or given topically enter the vitreous body through blood aqueous barrier and reach the retina in higher concentration than in eyes and with intact vitreous and an intact iridolentular barriers. Now, establishment of an unhindered path of light allows unhindered passage of light on the retina, maintains optimal transparency due to low concentration of structural macromolecules. Now, the pathological and pathophysiological correlations, that is the synthesis, symptolensis, asteroid hyalosis, hemorrhages, inflammatory material, fibrous tissue, lack of regression of the haploid artery. Now, other functions provide the pathway for the utilization of nutrition to the lens, ciliary body and retina, maintains media transparency, maintains shape of the eyeball, agnogenesis, act as an optically clear media for light to reach the retina. Blood vitreous barrier. Tight junctions, complex of retinal vascular endothelium, pigmented epithelium of retina and non-pigmented epithelium of ciliary body. Distal lamina of vitreoretinal junction. Vitreous cortex. Vitreous and angiogenesis. Angiogenesis inhibitory facts in vitreous are neutrophils, elastate inhibitor. Second one is the thrombopoietin. Third one is the pigment epithelium derived factors. All these factors are decreased in diabetic vitreoretinopathy, and proangiogenesis factors, vascular endothelium growth factors are increased. Then potassium content of vitreous. First one is the 100 hour after death. Decrease the concentration of linearly help to determine time after death. Applied aspects are just like the vitreous liquefaction. Most common degeneration change in the vitreous, appearance of coarse aggregate material which moves freely in the free vitreous, associated with collapse and opacities in the vitreous, black floaters in front of the eye. Causes of liquefaction are degeneration, post-inflammatory conditions, trauma to the vitreous, radiation, thermal effects. Then posterior vitreous detachment. Vitreous shrinks, causing development of cloudy clumps of vitreous seen as floaters. Pulls free of its attachments to back of eye at optic nerve. A large floater is usually seen which can resemble a cobweb, associated with sensation of flashing light as a result of vitreous pulling on retina. The separation of the vitreous from the back of the eye is called the posterior vitreous detachment. Then the traumatic detachment of the vitreous base. Spontaneous detachment of the vitreous base is rare, but has been described in case of high myopic Ehlers-Danlos syndrome, Marfan syndrome. Vitreous opacity. Vitreous is a transparent structure. Any non-transparent structure present in it will form an opacity and cause symptoms of floaters. Vitreous opacities. Physiological opacities. Residue primitives, haploid vasculature, perceived as fine dots and filaments which drift in and out of the field against bright background. Vitreous opacities exudates poured into the vitreous in anterior uveitis, posterior uveitis, pars planitis, pars uveitis, endophthalmitis. Then the commonest cause of vitreous opacities is the vitreous aggregates and condensation with liquefaction. Condensation of collagen fibrillar network may be senile, myopic, post-traumatic or post-inflammatory in origin. Then vitreous opacities. Amyloid degeneration, rare condition. Amorphous amyloid material is deposited in the vitreous, part of generalized amyloidosis. Vitreous opacities are small, white, rounded bodies suspended in the vitreous gel, formed due to accumulation of the calcium contains lipids, and formed due to accumulation of calcium lipids. These are what are the causes of vitreous hemorrhages? That is the diabetic retinopathy, hypertensive, proliferation, sickle cell retinopathy, microorganism, age-related macular degeneration. These all are the causes of degeneration and causes of the liquefaction. And posterior vitreous detachment is also an anomaly of vitreous And vitreous in our latest degeneration of retina, a localized pocket of missing vitreous invariably overlies latest degeneration of the retina. This all is about the vitreous base. So here the topic of vitreous is totally completed. Now you can study both the lectures, and if you are having any query, then comment in comment box. Till that, have a nice time and stay at home, stay safe. Thank you beta for sharing.